Good morning, everyone. Thank you for being here this morning. We are going through the UCA Accreditation Social Distancing Survey, Phase 1. This morning, we have Tracy Patterson from UCA to walk you through this process. If you have any questions as we go through the presentation, please use the chat feature. We just posted something in there. You'll be able to reach out to the panelists and we will address all questions towards the end of the presentation, but please feel free to add them as we go along and we will address them at the end. Thank you so much. And Tracy, take it away.
Good morning, everybody. Hopefully you're able to see me on camera this morning, but if not, that's okay. The important thing is that you can see the screen and you should have a slide up there that says Social Distancing Survey Phase 1. Welcome to this presentation and thank you for joining us this morning. For today's format, I have a brief PowerPoint presentation that I'm going to go through. I'm then going to go through some other screens and share some files and documents that you'll have access to. And then we'll open up for the second half of today's session. We'll be focused on answering your questions. We did at the end of my presentation portion of it this morning, we did make record of the questions that were asked yesterday and turn them into frequently asked questions. And so we'll review those at the kickoff of our questioning period as well. So I'm going to go ahead and get started here. So really quick, you guys all would have received the updated accreditation confirmation letter for social distancing and also the welcome packet. If you guys have not, or your organization has not received those documents, please reach out to us at accreditation@ucaoa.org. And that is a general email box that is answered by a handful of UCA staff associated with accreditation, and it's going to get you the quickest turnaround time on your questions. But for anybody out there that's still waiting to see that welcome packet, please do reach out, because it may have not transmitted or gone to spam or something of that nature. We want to make sure that you have that in your hands. Quickly, the components of the social distancing survey are two. You have a phase 1, which is virtual, and then a phase 2 that is on site. Covered in phase 1 will be your written policies, your required documentation and posting notices, medical record review, HR file and provider credentialing file review, and then staff interviews. And then the second phase is the on-site, which will be facility tour or tours, depending on the size of the organization, patient observation, and staff discussions. In phase 1, we put everything in there that we felt we could do virtually, and also because we are granting provisional status with your accreditation post phase 1, because we don't know based on travel restrictions when we're going to get to phase 2. To grant that provisional, we wanted to cover as much as reasonable possible, cover all of the standards, the different standards, whether they be patient care processing, quality, HR, credentialing. And we also wanted to make sure we did those staff interviews as part of phase 1, because what we're trying to do is ensure that that quality is there, where we have the tying of corporate policy and down to center procedure and process, that we're tying business plan and strategic plan down to day-to-day operations and what the patient feels and experiences when they come into the centers from a quality aspect. With the staff discussions in part of phase 2, those really will focus on facility items that we see when we go through that tour, those facility tours, lab logs, tagging of fire extinguishers, general physical plant type things, items associated with that. And then also the patient visit component. So we would be talking to the staff about orders tied to that patient observation, documentation, what they're doing within those steps and stages. So you get a little bit of some topics in both phases, just depending on the situation. But those are how phase 1 and phase 2 are going to be broken out. For the rest of the presentation, I'm going to focus on phase 1, which is the one we're scheduling right now. There are 4 parts of phase 1. When we did the pilot program with organizations and put it out in front of them, we tried to do, especially a single site or an organization that only has 2 to 3 centers, typically what we do is we do that survey in one day. Doing that in a virtual format wasn't necessarily the best. It just becomes a longer day as you share screens and waiting for people to scroll through documents and that type of thing. It became more problematic. Start and stop times with calendars became more problematic. And so our design now is based on these 4 parts where we've broken things out. And what it allows the organization to do and what you to do is if you have somebody that's your QI person, they have a more set scheduled time for that QI. And not everybody within your organization has to attend all 4 parts. We recommend a key person attend throughout the process of those 2 days, but it allows you to break up your staff and, utilize your own internal resources better. Day 1, we're starting both days are broken out to have 2 parts each. The first part starting at 9 a.m. local to the organization, and the second part starting at 1 p.m. local to the organization. So if you are in the Central Time Zone and your surveyors in the Pacific Time Zone, we will start based on 9 and 1 o'clock for you versus that surveyor. Part 1 will have the survey kickoff. We'll do review and attestation of certification. If you've applied for occupational medicine, we will do that criteria at the same time as the urgent care criteria. And then we'll do your policy and document posting reviews as part of that first block of time. The second part of day 1 is going to focus on your QI plan, including antibiotic stewardship if you've applied for that, if it's applicable. A little bit of commercial here. We do recommend that you check out the antibiotic stewardship. What we have found with many organizations that are going through the accreditation process is you already meet it. And so it is free to you as an accrediting organization to add this certification on to your organization, and it is something that you can use to help stand out both with the payer community and with, let's say if you like to work with local news agencies, I always tell them it's a great thing to let them know that A, you're accredited, and B, you've reached this antibiotic stewardship status. So when they want to come and talk to you about the flu season and now the COVID season, I guess, as well, you will be able to maybe stand out from your competition and have them work with you. I always think, new spots is free advertising and it's a great thing to do. But as I said, many of you already meet the criteria, and so I would definitely check it out. And it's a nice thing to let your patient population know as well, as that you're keeping up to date on the best treatment for them in regards to antibiotic use. So end of commercial, but I do recommend that you check it out. If you do want information and you haven't seen the program, for any questions that you come post this or anything I discuss, you're always encouraged to email that accreditation@ucaoa.org. The second day, part 3 will kick off with HR and provider credentialing review. And then the last part of the day day 2, part 4 will focus on your staff and provider interviews, and then the survey wrap up associated with that. Just like posted, for those of you that have already been accredited and you're going through your reaccreditation, you're familiar with the process that at the end of the day, we do this readout where we give you an idea of our findings, what you'll expect to see in your accreditation letter. That is that survey wrap up, and that will continue. What will happen, because we're in 2 phases under social distancing, you will get a letter issued with both phases. With phase 1, if we didn't have anything that required action, you'll get the letter that states that, and the remaining steps that we need to grant that provisional accreditation. If there are items that need to be addressed, they'll show up as those actions required. Once those are taken care of, we will then issue that provisional status. With provisional status, as we had emailed about earlier, it does not appear any different to the outside. So it'll be the same certificate for the wall, the same look and feel. So as you use that for your credentialing organizations and your payer organizations and to the public, it will look the same. It won't have a statement on there that says it's provisional. When we get back out on the road and schedule your phase 2, go through the same thing. If we have any actions required or findings post that visit, they will come to you in a letter, a part 2 letter, a phase 2 letter, excuse me. And then we'll address that at that same time. we wanted to give you guys as much resources and tools that you could have. So everybody on the phone call should have received your confirmation of the change in process through the social distancing letter, and then also received the welcome packet. If for any reason your contacts that are listed with UCA in regards to accreditation did not receive those items, please reach out to us at accreditation@ucaoa.org, and we will turn those around very quickly to you, as we wanted you to have them already in your hands before this presentation. But we think most of you, or all of you, should have them. The other things that we've created is a Dropbox folder file system. So as we have to do uploads and share documents both directions, you will have a folder specifically associated to your organization with that you will have access to, and whoever you grant within your organization will have access to, and then the UCA staff, accreditation staff, will have access to it as well. In that folder system, we have already pre-populated these resources and tools, and I'll do a little tour of Dropbox at the end of this presentation. But we have put a copy of that accreditation letter and the welcome packet up into that resource file. We've also broken out all 3 checklists that were issued with that welcome packet into individual documents. So if you want to download those and just send the HR checklist to your HR person, you don't have to forward the full welcome packet. You can print out these checklists and get them into the right hands and to the right people to focus on what you need them to do within your organization. You'll also will have received a template for the staff provider listing in Excel. So you can submit that file as an Excel file, a CSV file, a Word document, some other type of file download that comes from your HR management system. But for those of you that want to see a sampling of it or that want to use Excel to submit that information, we've created a template for you and uploaded it into your resource file using Excel. Also have created a document that lists key due dates and upload calendar with a sample of, if your survey is on this X date, this is the date you should have submitted in your staff listing. This is the date you should have submitted the mandatory policies, as a quick reference guide for you about, for everyone, for getting the documents uploaded into the system. Some other key steps and timing items, of course, attending today's webinars, and thank you for doing that. And then on an individual organization pre-survey, we will schedule a pre-survey conference call with you all. That call will be attended by quite possibly the surveyor that's been assigned to your organization and UCA staff, or one or other, depending on scheduling constraints and the timing of that, if the surveyor has been assigned by the time we get that conference call scheduled. Other items are to upload your staff and provider listing. And when we upload that staff listing, the selection if you want to do your interviews as scheduled interviews or unannounced interviews. And more details about that process is on the HR checklist and inside the welcoming packet. Others is the mandatory upload of specific written policies. There are 6 policies that we need every organization to upload that will be reviewed in advance by the surveyor, which will be important for them as they do medical record review and some of the other survey components as they ask questions. And so there are 6 policies that we are asking every organization to submit and upload for pre-review to your scheduled survey date. And then you will have another choice of, just like with the staff and provider interviews, if you want to do scheduled or unannounced, is if you want to upload your files, your other written policies, documentations, and pictures of your postings, or if you want to screen share on the actual day of the survey. There are pluses and minuses to both options, and so we wanted to put this choice back into the organization's hands for what you feel comfortable with, and we will work with either one. But inside that welcome packet is some details on what we consider the benefits of both choice, and we'll just ask you to make that selection. If you do choose to do the file upload, there is a timing requirement associated with when you have to have those updated before your survey. With the technical components of phase 1, with your reviews and in your interviews, they're pretty universal. We need a computer with an internet connection and webcam so we can see you. You need a voice connection. What we have discovered is that phone is preferred over computer audio. We've had some distortion and problems with people using their computer audio, either the internet connection used or the age of the device used becomes problematic in many cases. And so we do recommend that you use your computer or your laptop for that internet connection and webcam, but then in sharing screen, but that you switch over to a phone if at all possible to handle the audio portion of the survey. And then you'll want to make sure that you download your meeting application and that you know that you can connect in prior to the launch of the survey. So when you get your individual site survey schedule, we will allocate some time pre that 9 a.m. start for the IT team to jump on if need to, troubleshoot, make sure your connections are working. If you do want to schedule that pre-survey day, we will work with you to do that if based on your IT team's availability. The one difference with your staff and provider interviews, they need to meet all the technical requirements up above, but we are asking that we ensure that they have some private space for this one-on-one with the surveyor. You are more than welcome to attend. We just ask that you attend not within the same room and that you also attend through the web camera. Our goal is to get that person being interviewed very focused on the surveyor and not necessarily others within the room. And we want to discourage any answering or volunteering of answers when that person being interviewed gets stuck. Because what will happen in that case is we'll have to extend the interview and ask them more questions to make sure we get a full interview of the actual person that we intended to ask those questions of. Really quickly on phase 2, the end-site survey, yes, you'll be granted your provisional status before we do this and before we schedule it based on meeting the criteria under phase 1. Our timing on phase 2 is just unknown. We're kind of watching travel, and it may open up to certain parts of the country before other parts. You know, it's just going to be a different kind of rollout process. We have quite a few organizations that were canceled and postponed between March and August, March and September, technically, I guess. And so we have to get you all scheduled, and we'll be able to do multiple phase 1 surveys within the same week with a surveyor. When we open back up and we have to get that surveyor on the road, we just can't put them that close together, right? So we're going to have to spread out. So the phase 2 will be a little spread out, and we'll try to hit probably based on region and scroll through and get those tackled to be the most efficient use of time once we open that travel back up. And to note that your surveyor may differ. So your surveyor, you have a small possibility that even your surveyor between day 1 and day 2 will differ based on scheduling of phase 1, but there is a stronger possibility that the surveyor that comes out and does phase 2 is different. So our focus with phase 1 is to get you scheduled and get you scheduled with a surveyor that's completed the virtual training aspect of this and to get these done quickly. And so we're not really concerned about where that surveyor lives and is coming from, right? Whereas in phase 2, if we have a surveyor out in Arizona, they'll probably be more likely to pick up West Coast type surveyors. So greater chance of seeing a different surveyor on phase 2. And for those organizations that are larger, you guys are used to seeing multiple surveyors anyway to get through that process. So that's part of that as well. So we get it all accomplished in 1 week, right? So we don't have to extend that process. If you have questions, comments, concerns, this accreditation at ucaoa.org is your best bet. Many of you have my contact information. It's the last slide of this deck, and others within the organization. And you are more than welcome to reach out to anybody. But what we have going on right now is 5 people currently, I think, have access to this box, and we're really trying to get responses out as quickly as possible. So we do recommend, at minimum, you at least copy this email address if you just don't send directly to it to get that response. I'm going to go ahead and change my screen and toggle over to some of these documents so I can review them quick, and let's show you guys the Dropbox filing system. So this is the Dropbox filing system that you'll receive. This is inside an organization, and the file, oops, let me click into it. You'll receive a file that says SDS accreditation, a link to this Dropbox accreditation files, and then it'll be a dash, and then it'll have your organization's name up here instead of sample organization. And within everybody's file system, there will be 5 folders. The first folder is going to be your resources, which includes your welcome packet, your checklist, and your submission date calendar, and then also a copy of that letter. It will also include the template if you want to use it in Excel for your staff listing. So right here, you'll see all of these. We've pre-populated the folders, and we'll get your link sent out as we go through the tenets of these 2 webinars and start discussing with you your scheduling of your phase 1. So you have, as I said, the individual document checklists, and what you can do is over on this right, you'll have some things about uploading files, creating folders. The folder system has already been created, but over here you can also share, and then there is an item here when you click on this that it will then allow you to download these files as you select them. So you can go ahead and download any of these, and these are already in your resource welcome packet. The next folder within the system is your mandatory written policies. And so when you click in here, you will upload. So this was the sampling of how I uploaded yesterday's thing, but right here to upload those 6, you'll just click over on the right-hand side, this upload file. And then you will go to using the file management system on your computer. You'll go and find the folder that you want to pull those policies from, and then you will click on them. And you can select multiple ones at the same time. So if they're in the same folder, you can select all 6 of them together and go ahead and hit open. And you'll get this message down here that they're open. Now, what you will have noticed is those 2 documents, you don't see them on the screen. You have to refresh in Dropbox, and so I'm going to go back. And you can do that by going back a level and then just re-clicking on it. And then you can see I have 2 more files within Dropbox. They're there. Dropbox just doesn't like to show them to you until you refresh that screen. So don't go ahead and hit upload until you have a chance to go in and out and refresh that folder management system so you can see that they actually did upload. And so you'll want to put those 6, and those are due 3 business days. And we tried to put that in the title. When they're due before your survey. So those 6 mandatory policies would be uploaded before, but at minimum 3 days before, business days before your survey. And then this one is where you would put your staff and provider listing, and this one is due 10 days before your survey. So for those of you that we have pre-scheduled, you may be a little short of your 10 days. We are aware of that based on what we've done for scheduling of some items, and we understand that when we'll work with those organizations that agree to that for those that were looking to have their surveys at the end of August as we do that scheduling. And then you'll upload here. This is also where we will upload our selections. So we'll continue to keep this folder in play, and we will email back to you the staff that we choose for the HR file review, and we'll upload it here. And then also, if we're doing those scheduled interviews, that list of people that you get to select from for those interviews will be uploaded into this folder as well. So you have the two mandatory uploads are the twos, the 2A and the 2B. The last three files are the optional uploads. And just give me 1 second, I have a banner. And then there's an HR and credentialing folder, a required documentation and posting, and then the required written policy. With these folders, we have preloaded and put folders in place that match up to the checklist. So as I tab over here and go into that checklist, just looking for what happens to my PowerPoint. I'll find them. Let me see. Just I'll flip this way. Here we go. Or maybe not. There we go. You'll see that these checklists have broken out into sections: governance, patient care processes, human resources, physical environment. And with these checklists, we've given you the actual standard expectation associated with it. So in PCP 1A, you have a requirement for a written policy for 2 patient identifiers. If you choose to do, now this is one of the mandatories, so PCP 2E, communication with primary care, if you choose to do your file share option, once we go back into Dropbox, you can see that you can open up and put in these folders all of the written policies associated with patient care processes, health record management, HR. So those folders have been pre-created for you. What I want to say in uploading files and naming of files, create yourself a key. So if you have a unique way of naming things that don't match up, that you can help that surveyor with that matchup of those file names. You don't have to rename everything to our title. We just need a key or mechanism so we understand what that naming is. And a great way to do that is just to print down that checklist and write the name of the file or whatever indication that you want to next to that. And it's the easiest and quickest way to do that. But however you want to create that key is welcomed by the UCA team and staff. And then the same thing was done for the required documentation here as well. Those based on that checklist, these different main categories are broken out as to folders within the Dropbox file. Under HR, if you decide to file share versus screen share, you would create a folder per staff person. And so over here, you can create a new folder, label it with their name for that selection, and just to create one per person. And then you can just, each one would have a folder associated with that. So that is the Dropbox system, and you'll all have a unique one to your organization. And then really quickly here, so in that resource folder, you will have the letter that was already issued to you originally in draft and then in the final version. And then we will have a copy of the welcome packet that you should have received. And this welcome packet does have at the end a copy of all of the checklists as well. So the checklists are located in 2 areas. Then you will have the individual checklists as separate documents within that system. And then you will have over in Excel, you'll have that template of the sample staff and provider uplisting. Staff and providers can go all within the same listing, or if, because of the way your system works, you need to provide us a staff listing and a provider listing separate, we will work with that, or you can create separate tabs in Excel just by clicking the little plus mark down here, and you can create a second sheet if you want to keep them separate that way. We will work with you on how that data is submitted. The key important thing is that per person, per row, we kind of get the information that's listed across here as our most important thing as we look at that, so we can do a correct selection of the staff files that we want to look at. So jumping back into the PowerPoint presentation really quick, these are some of the questions that came up. When will you have access to the resources and tools? Shortly. So you should have had the welcoming packet already. As I said earlier, please reach out if you didn't. All other resources and tools, as soon as that Dropbox folder is granted, access is granted, they're already in there, so you'll receive them then. We expect it's going to be the latter of within 5 days of attendance of this webinar and the scheduling of your SDS survey. So what we will be doing with those organizations that attended yesterday and today is reaching out over this next week or so and attempting to get those scheduled. We will tackle them in small groups to reach out, get the dates associated with that and availability, and then reach out to the next group. And we're trying to clean up organizations based on how long they have been postponed. Not maybe necessarily exactly when you were canceled for when your survey was scheduled, but based on the date that you were due, and tackling those organizations that have been extended the longest. For the documentation posting checklist, there are some things under public and advertising. How do you want to see those, and do you want to use photos? Yes, photos are great. If you can take a photo and upload it or screen share it at the day of your survey, that works perfectly. You don't have, if you have 10 organizations, we do not need to see photos from each of those organizations. We're going to let you submit one item per the request. So one photo of your hours, you pick the center, show us what that typically looks like for you as an organization, and then we will do posting confirmations when we do the phase 2 on-site visit and look at those postings for every facility that we end up visiting as part of phase 2. So we just need a sampling, one sample of each for those sections. How secure is Dropbox, and what types of files should I not upload? So right here on this is Dropbox has done a lot of work into making sure they have security and privacy. They have a page designated to that, and they go through all of their certifications. So to review that more, I'm going to direct you to their dropbox.com/business/trust website page, so you can access all of those links. Hands down, we do not want you to upload any documents containing PHI in regards to your patients unless they have been fully redacted. That's tied back to the fact that we won't do file share for medical record review. That has to be through a screen share and active with your EHR. So for the rarity of anybody out there still on a paper chart, there's a small handful out there, but we will not be doing the social distancing survey or the virtual format with that organization because you would need to have an EHR because we are doing screen share only at this time and need to see what that EHR looks like and the flexibility of that. Also, if you choose to do your HR as a file share, that's fine. We do ask that you not upload documents that have very private information to that individual. So if it's got a combination of data on it, you would need to redact social security numbers, personal addresses, salaries, those type of things if you're going to do the file upload. If you have any concerns about security or any particular document, please do reach out and talk about it with us. With the HR, the majority of what we look at is, I don't want to say public information, but pretty public information, confirmation of their license, training certificates, ACLS, CPR cards. We will allow you to upload the majority of the HR and credentialing items. And then for the certain key items under HR, we can do those as a screen share, such as I-9 documentation, background checks, those type of things. So just as that pre-survey conference call, or just individually reach out if you want to talk about this more, about what you want to upload versus not upload. Just want to reassure anybody that any file uploaded pre-survey will be deleted post-completion of that survey. The only exception is if you do have actions required listed on that the letter post survey, that information has been and always will be kept because it's reviewed on reaccreditation and it's a record of your response. But anything that's done just to make the virtual portion of surveying work, that will be deleted off of Dropbox post completion of the survey. The other thing I wanted to talk about is the difference between file share and screen share. What we review is the same. There's not a gain or a loss based on the number of files we review. So we, of course, will not review every written policy your organization has. We will make a selection of those policies to review. You need to be prepared to show us all of the written policies that are required, but we're not going to go through them all. And that number does not change based on if you choose to do a file share or screen share type choice, right? So that's going to be, that's not going to impact that decision of what gets reviewed. Same thing in regards to HR files. We'll pre-select those names, and whether you upload those or screen share them is irrelevant. That number is not going to change. The only way we would ask to see additional HR files is if we discover a problem upon review, and if we want to determine if it's an actual problem with process and procedure, or if we just got unlucky and happened to pick somebody where something was just truly missed. So we might explore that further based on what we see within that survey. Next question from yesterday.
Tracy, this is Jamie, real quick. I'm sorry, you have a gray bar that looks like that banner is kind of hovering over the right of the screen. So if you wouldn't mind closing that out so everyone can see the complete slide, then we'll be good to go.
Is that better?
It is, thank you. It looks like it moved a little, but we can see the content now. Thank you.
Will SDS phase 1 scheduling be like previous with the range of blacked out dates? In the future, yes, after we've scheduled all the postponed and canceled, if we're still on the SDS, the social distancing type surveying format, it will be like historical scheduling, and we will ask for a time period and we will allow you to do blackout dates. For the organizations that are on the call now, you've been postponed and we're kind of behind schedule, right? So what we want to do with you is work more closely with you to get requests for your available dates and then match those dates back to surveyor availability. So, you know, from that aspect, I think it's a little more control in the organization's hands about when those get scheduled. And if for some reason we can't make that process work with an individual organization, we'll go ahead and issue a time period and ask for blackout dates. But we really want to get you guys scheduled quickly and make sure that we get everybody caught up over the next couple of months. And as part of that process, we'll be asking for your specific availability and making every attempt to match that back to a surveyor. And if for the couple of options you give us, if we can't make those options work, we'll ask for a second group of options. But our goal is to really get these scheduled quickly. And so I think that it's kind of a benefit of this is you'll have more availability to say, you know, these are the dates that work for us. And we'll reach out to you guys individually and talk through that process as part of post-webinar survey scheduling. So this is me, and as I said, you're free to reach out at any time. I've listed my cell phone and my email address at the bottom. Once again, am going to encourage you to use accreditation at ucaoa.org. I'm still on the road quite a bit for the other work I do, and I'm one of those West Coasters versus the East Coasters, and so with staff, we have staff that monitor that inbox, you know, earlier in the day than I do, and especially if I'm traveling. So, but same with any staff, you never know when somebody's, you know, out of office, and so we encourage you to the use of that general inbox. So that takes me to the end of what I wanted to present, and now I'd like to open it up to questions. If you haven't already, please post your questions into the chat portion, and staff will be serving as a moderator to get us through those questions. So do we have any questions posted out there?
Yeah, thank you so much, Tracy. We do have a couple. So first one, will surveyors choose the staff to interview?
So you, based on your staff and provider listing that you upload, as an example, let's say you uploaded, you have 10 types of employees. You have a, and this will be good here, let me scroll this over. So we'll get a list like this here. I don't want to do that screen. Give me 1 second. I need to get to the welcome packet. So just like we will do on the file review, we will select based on your organizational size and roles. We will select a subset. So we'll say if you have 50 providers, we would like to interview 2 providers, and out of your 50 providers, please present to us 2 of the 10 we've selected. So we will narrow that category down, and we'll, by staff role, we'll ask to speak with 1 person, 2 persons under that role based on a limited list of that provider group. So you will still have control and enough of your staff to select from that interview list, but we will pare it down, and then based on that pared down list, you will tell us who you ended up finally selecting for interviews. So you'll get back a list of X number, and you'll have to pick by category who you want to see. Now, the actual number of files we review and the staff we review are dependent on 2 things: the size of your organization. So we do look at less for the single sites versus the ones that have 100+ sites, but also based on your role. So, you know, some organizations use RNs and MAs, and they have a different scope of practice and different licensing requirements, and others are just MAs, X-ray techs. Some states, you know, your MA is your X-ray tech. So based on those roles, you may have just a smaller number of job descriptions, and our goal is to look at HR files and interviews based on the job description and roles that they complete. Some organizations use lab technicians to run their on-site labs and point-of-care tests, and their goal is to just do lab testing. And so if you do have something like that where you have designated lab staff, we'll then review them separately. So based on the roles that you have within your organization, and how that state may treat scope of practice between, you know, MAs can't do medication in your state, you have to use an RN, then we'll be looking and speaking to more people based on your particular situation. So as part of identifying, we will look to get this information from you and then give you a final count.
Great. Thank you so much. The next question, what if our organization won't allow Dropbox?
We can have a discussion with you if you need a different type of file system. And then what we would do in that case is, instead of on the mandatory files, instead of having you upload them into Dropbox, we would ask you to submit them in through email, whether you need to submit that email in through a secure email portal and within your system, and then we will manage them on our end here. So if we can't get to a file share agreement, we will then work through secure email, and then your organization will have to do screen sharing and not have those optional choices of file upload. So we won't take a mass amount of files through an email system, because it's going to get too confusing and things aren't good. It's going to be a file size issue and that type of thing. So if your organization says no file shares, no Dropbox, or no other file shares, the stuff that you have to submit, the staff listing and the 6 policies, we can manage those through secure email, and then we will just earmark your organization as a screen share organization.
Okay, those are all the questions that we have in the chat feature at this time.
Okay.
If anyone has any, you can quickly get typing out there. Otherwise, I think that's it. So, says
Well, I want to
one last one. I'm so sorry. Is that we use Google Drive? Can we share the folders with UCA?
I believe that will work. I need to make sure, I need to review my own technical items here, but I'm familiar with Google Drive, and we should be able to make that work. So for that organization, when we do your pre-survey call, we'll discuss that, but I'm going to say I'm pretty sure we can make that work, but I need to do the technical check on our end as well. But I'm familiar with Google Drive from using it with other work. So yes, I think that could work. We would just ask you to maybe mimic titles of those folders. So whichever surveyor or staff that goes in there, it has some familiarity for them to maneuver around that folder system. But I think so, but we'll need to confirm on our end.
Right. And if you would send an email to that accreditation@ucaoa.org with that information, then we'll know exactly who to follow up with regarding that. So I think we're all set at this time. I don't see any additional questions in the chat box, Tracy. So,
okay. Well, thank you everybody
moments.
for joining me this morning and going through this. One of the questions asked was, would we be sending out this webinar for post review? And that is our goal. So fingers crossed that the recording worked well and that we can get this sent out, but that would be another thing that we would either hopefully be able to add to your Dropbox folder or even just issue via email. So we will work on that. So if anybody within your organization couldn't attend with you today that you want them to see, or if you just want to re-review it, just to maybe pick up on some details that you missed, or I'm sometimes accused of speaking too quickly. So if you want to re-review that, that would be an option as well. So once again, thank you everybody, and it was a pleasure to present to you today.